Welcome to the DTS Fitness Education Podcast. My name is Ben McDonald, and I am here with my main Canadian mate, Ken Kinakin, a.k.a. Dr. Ken, practicing chiropractor. How are you, Ken?
I'm doing well. Thanks for having me on.
Fantastic, my mate. So we're just going to get directly into the information, my mate, because as we said before we hit record, if it's just left to me and you, this could be like a conversation that just goes on and on.
Yeah, it will.
All right, so let's just get straight into it then. Question number one. Have you personally ever dealt with back pain?
Myself, yes. So I've been practicing for 28 years as a chiropractor. The reason why I got into chiropractic is I'm a competitive powerlifter. I've been competing. Last year was my 40th year competing in powerlifting.
Wow.
So when I was in the, how old was I? I was about 22. And I was getting ready for the, actually it was 1983. I was getting ready for the Canadian Powerlifting Championships. I was going to try and make the world team. And I was squatting about 525 at that time. At 165, and 2 weeks before, my right knee, it sounded like a bed sheet ripping. So I couldn't squat. So I was done. I was taken out. And so that was the journey that I was on to try and figure out, how to recover from this. So I went to medical doctors. They said, don't squat. I said, I'm a competitive powerlifter, massage therapy, physiotherapy. And what essentially happened is my dad goes, why don't you see a chiropractor? I said, why? It's knee, it's not my back. And he said, go. So I went, and the guy was able to, he did muscle testing. So he's testing all the muscles. And this was 9 months later. I could squat up to 400 pounds, but I couldn't go any heavier unless there was pain. I could run, I could go up and down stairs. And he said, your knee actually healed a long time ago, but when you overload the system, it just gives out. So he says, it's actually coming from your low back and your SI. And I went, oh, okay. So, and Merv is 130 pounds. He's a marathon runner. He's not very big. So my right leg, everything was weak when he was testing it. Left side, he could have done chins off of. So literally after 2 weeks of treatment on the low back, we didn't even touch the knee. The strength came back because there was a neurological inhibition from the low back area down the right leg when it was overloaded. And I think that's the big thing that people really miss. So I got inspired. I'm from Kelowna, BC. I basically packed up and came out here in 1986 to become a chiropractor. It's the only chiropractic college in Canada, so I had to come to Toronto. So yeah, I've experienced low back pain. I know another funny story. I was at this one clinic. And I said, you know what, can you take an x-ray of my low back? This was about 7 years ago. He said, sure. He said, it feels unstable. They went, all right. So they took an x-ray and a side view of my lumbars, and my L3 spinous process was fractured in 3 different places. I have no idea how, why, or anything else. But every time I started deadlifting heavy, it just felt unstable. Well, no kidding. You got part of your back floating in there, within the muscles, and it's pulling. And the L3 is one of the most instrumental vertebrae because a lot of the different muscles attach onto the spinous process, which mine is all over the place. So yeah, I'm still training heavy. I train every day. I'm still going to compete in powerlifting just because I like it. I'm in a weird category where I'm old as dirt and still wear a single ply, and so there's really not many people in my class, but I just go and have fun, which is what it's supposed to be.
Oh, 100%, mate. That's fantastic. I like that when it's like, how many people, I came first. How many people in your class? 1.
Exactly.
Hey, that's the way to go, my man. You know what I mean? I'm gonna wait till I'm about 80, and then what I'm gonna do is I'm gonna start powerlifting when I'm 80. You know what I mean?
There
and then
you
just
go
in. I will be world champ.
Against me, I tell you.
Oh yeah, I never thought of that. I might go back to the UK and do it there. You know what I mean?
Yeah.
Excellent. So, question number 2, my mate. What is your best advice for someone with chronic low back pain based on your experience, Ken?
I think the biggest thing is to get a proper assessment. You really have to differentiate between a muscle problem, a joint problem, a nerve problem, or a biochemical issue. a lot of times, so from my profession, chiropractic, we will always look at, is there a joint problem? The facet joints, the sacroiliac joints, and everything else. The challenge that we have within my profession, which is changing due to a technique called active release technique, is we always forgot about the muscles. So we never really treated the muscles because we always thought everything was from the joints and the nervous system. Conversely, you have massage therapy and some physiotherapists that they would focus in on the muscles. So they go, the muscles are weak, so therefore, we should do some strengthening exercise, which sometimes works excellent. The challenge being is if it's a joint problem, you'll create an inhibition no different than what I experienced personally. And so therefore, it won't work as well. So you really have to find out, am I dealing with a muscle problem? Am I dealing with a joint problem? Am I dealing with a nervous system problem? And nervous system now is turning into two different things. And about the last 2 or 3 years, been focusing very heavily on the brain. Because what we're starting to see is that if you've had pain in the low back long enough, it actually changes the brain. And so all of a sudden, your ability to contract or your perception of pain alters. I worked with 13 medical doctors in a chronic pain clinic for 5 years. So I saw real true chronic pain and how much it actually changes people's brains. So that's the other thing that we're starting to see, a new emergence of treating low back by doing brain protocols. So that's another one. And then the last one is biochemical. Are you dealing with inflammatory issues? Because if you're constantly inflamed, that's what's also going to give you pain. So the biggest thing is, number one, get a proper assessment. Muscles, so range of motion, strength, everything else. Joints, there are certain tests that we do, orthopedic tests, to see whether or not the joint is loaded. And then the nervous system is also related to your ability to move correctly, do the muscles fire correctly. And then the last one, which is a good thing and also a bad thing, is diagnostic imaging. So this is your X-ray, this is your ultrasound, this is your MRI. What we're starting to see, though, is that this gives us an idea that it is there, because, as far as, say you do an MRI and you have a disc herniation, and a lot of people go, well, that's that's where your pain is coming from. The challenge being is that you may have had that disc herniation there for quite a while, but is it actually the main cause, or is it a contributing cause? And the other thing, and Donnie Thompson, one of the presenters at Swiss conference I put together, was working with a number of orthopedic surgeons, and they were doing pre and post MRIs on people that had disc herniations. Like they would do an MRI, and then 2 years later, do another MRI, and you would see the disc herniation either shrink or disappear. And I'm like, when I was in school, apparently that was not supposed to happen. And yet we're finding that the body does have the ability to heal itself. So that's what I'm starting to see. So you want to take it from a functional standpoint, as far as, does a person function? Do they have good strength? Do they have good range of motion? And can you actually increase the pain by doing different orthopedic tests? Then you correlate that with what you would see on an X-ray or MRI. You really never diagnose, what I was taught in school, you don't diagnose off an X-ray or an MRI. Because a lot of times I could put up 2 X-rays, one complete disc degeneration, the other one looks perfectly normal. I ask people who has pain, they would always point to the disc degeneration, and I go, no, the other one does. So it backs up your actual diagnosis, your differential diagnosis, as far as what you think it is, and then you would build a protocol of a combination of treatment, rehabilitation, exercises, and any other protocols that you would use.
I think that's fantastic, mate. And I like what you said there about the body wanting to heal itself. I think a lot of the time we've just got to create the environment for it to give it the ability to heal itself, and it'll 9 times out of 10, a lot of time, unless you're an outlier.
Yeah, I think the biggest thing, and Stu McGill, Dr. Stu McGill, brilliant researcher. I know you're going to have Joel on here talking with about that, is what he presented at Swiss in 2018, is that what we tend to see is the vertebral bodies, sometimes they go through what is known as microfractures within powerlifters. So the whole thing is that that is actually a good thing in powerlifting because it actually builds up the resistance. It basically strengthens the bone. What does tend to happen though too much is that you don't give it enough time. And time is really, really important. People kind of misjudge that as far as, you know, trying to heal from an injury. And if you don't give enough time to allow the bone to heal, it'll actually go through from a microfracture to a macrofracture. And now you end up with, you know, end plate sclerosis and, you know, fractures and everything else. And that causes pain. Same thing with the disc. Training heavy all the time is not necessarily the best thing. And there was actually a study that they did at University of Saskatchewan, and a guy came in. He had classic disc herniation signs. So what that is that if you're laying on your back and you raise up the leg, it's called the straight leg raise, and you could only get it to 70 degrees, and he's in extreme pain, feeling pain all the way down into his foot. And so that's a classic one. He lost his knee reflexes in that one leg. He had what is known as foot drop. So what happens is as you walk, he can't hold up his anterior tibialis, which is an L5. So it would slap on the floor. The left side would be fine. And he was getting atrophy of the actual right leg. Again, another distinguishing sign of a disc herniation. Did the MRI, and because it was in a university hospital, they did conservative therapy, they did exercises, they did chiropractic, they did soft tissue therapy, rehabilitation. I think they even did a little bit of traction at that time. And over 12 weeks, he recovered. Knee reflexes came back. The size came back. The foot drop went away. The straight leg raise basically was up to 90 degrees, no pain. So virtually it looked like it was healed. They redid the MRI and the disc herniation was identical.
That's crazy.
So this is what we're starting to see. Whenever there's a disc herniation, that the inflammatory products within the disc or in that area was actually creating a lot of the symptoms, the pressure on the nerve and everything else. And over time, it would get reabsorbed, all the inflammatory products, it would strengthen up, even though the disc herniation was the same. So it wasn't enough to, you know, create the actual symptoms, but the inflammatory process around it. And I think we're starting to see that more and more. So this is where all these people are saying that I have a disc herniation, I can never do anything. Yeah, you can. You just have to be intelligent about it. And Dr. Stu McGill's probably been one of the best at it as far as just telling people, you know what, just take some time off. We're not talking days or even weeks. We're talking months, you know, and do these rehab exercises that won't stress the spine in an axial load. So just allow it to heal.
Yeah, yeah. No, I like that, my mate. I like that. All right. So question number 3, is there something based on your experience that every person with back pain should question?
Is there something should question? I don't understand the question.
So is it something?
What do you mean they should question?
Yeah, it's something, somebody's telling them something or they have a belief about it.
Oh, right. I think the biggest thing is that whenever you get back pain, your friends and family will give you well-intentioned bad advice. And what I mean by that is that you're a mechanic and all of a sudden you're learning rehabilitation exercises and ideas that work for you, which may have worked for that person when he went to see the physio or the chiro or the medical doctor, but it has nothing to do with yours. So, I mean, if you basically strained a muscle in the low back and he had a joint problem, guess what? Going to see a chiropractor, if they just do straight manipulation, won't. So that's the well-intentioned bad advice, that go see a professional, get assessed properly, and go from there. And for God's sake, don't try and Google, you know, low back pain, because all of a sudden you're going to think it's a friggin' tumor or some weird disease that, you know, the doctor on house found once, and, you know, it just goes on and on. So stay away from Google, stay away from Facebook and Instagram, because all of pain is individualistic. And there's a number of different reasons why you may be experiencing. And it can be something as simple as, you know, the way that you sit. It could be your car seat. The amount of people that I basically, the clue that I always say, it always bothers me when I drive. I go, okay. So I'll actually go out into their car when they come in for an appointment. I'll go to their car and I'll sit in their car. And if it's an older car, like say 10, 12 years old, and the person is a bigger person, I will sit in it, and literally within about 15, 20 seconds, I will get low back pain. The reason being is their car seat is broken. So I'll take my fist and I'll push it actually into the seat in the different areas. And there'll be one area that's completely compressed down because they lean like this. So they're putting their entire body weight. They crush the poor seat. And from now on, they're always going to have back pain if they stay in that seat. So either they get a new car, or sometimes they just go to the wrecker and they change the seat. Bingo, all the pain is taken away. Had nothing. I could treat them every day, and that will not take care of their back pain because that was not the cause. The cause was their car seat. Now, does that happen all the time? No. But if someone does say, I get back pain every time I drive, take a look at the car seat, especially if it's an older vehicle.
Excellent. Yeah, I see where you're going with it, mate. And when you talk about like well-intentioned advice and staying away from Dr. Google, my wife is the worst, mate. She's like, oh, I just feel this in my throat. I'm just going to check it on Google. She's like, oh my God, you know what I mean?
Yeah, I know. It just gets worse and worse. So
that's fantastic, mate. All right. So question number 4, brother. When it comes to back pain, what, in your opinion, is something that is rarely addressed or understood?
I think the biggest thing is that people start doing exercises without really understanding what is the actual problem. So if it's a nerve problem, those are certain protocols. If it's a muscle problem, those are certain protocols. If it's a joint problem, those are certain protocols. So I go back to the original. If you analyze it, if you get it assessed properly, and here's the other kicker is that you can't have a muscle, joint, and nerve problem all at the same time, especially if it's a chronic problem. All of them have to be addressed at the same time. So that's what happens sometimes is that if you just see a chiropractor and don't get the muscle and nervous system, addressed properly, then, it won't work as well. So a lot of times when patients come in, I'll have to do acupuncture and active release and do adjustments and also do laser and also do rehabilitation and possibly even some brain work and some nutrition just to try and recover from that, because they've seen everyone else, but they would see a chiropractor for a month, didn't work. They would see a massage therapist for a month, didn't work. They would see a physio for a month, doing rehab exercises, didn't work. And the reason being is that you have to do it all at the same time. When you do that, then you can get much, much better results, but you got to know what you're actually dealing with.
Yeah, I think that's the key, mate? Whether you've got to find out what is the...
you got to find it. And people automatically think that if something is weak, then it must be due to a conditioning problem. So I need to do exercises. Well, it can be weak due to possibly the joint not moving as well. And we see this a lot with the sacroiliac joints. So that doesn't work as well. So if you do a combination of, getting the structure moving correctly and also the muscles starting to fire correctly, then the rehab exercises work really, really well.
Fantastic, mate. Fantastic. Okay, so question number 5. We are motoring through these, Ken. Motoring. I like it. Question number 5. What is your number 1 resource you recommend for people with back pain?
In regards to...
It could be a book. It could be a TED Talk. It could be,
Well, I would basically default to Dr. Stu McGill. Dr. Stu McGill has written a fantastic series of books about back pain and his assessment system on that. That would probably be my number 1 resource for it. And he's very knowledgeable in the different areas. So that would be probably my go-to for that. From a chiropractic standpoint, we have a number of them, but I don't think it would be relevant to the listeners here for that. But there's just so many different techniques out there. to give you an idea, there's 220 different techniques for chiropractic. I could send you to 10 of my friends. They'll treat you 10 different ways. And guess what? They'll probably all get results. No different than you go to the medical doctor and he gives you a pill. Now the pill, there's literally thousands of pills. So the modality is the same, and the delivery system is the same. But the combination of what's in it makes the difference. So a heart pill is different than basically an antidepressant. So those, even though they look the same or very, very similar, they would have dramatically different effects on the body. So very similar with what we do in chiropractic. So that's why people get a little bit confused when they see a chiropractor. They went, oh, that's not what I expected. But that's the technique that they learn and that they feel comfortable with in doing. So that's why you may see a chiropractor and it doesn't work as well, because it wasn't the actual technique. No different than my mother. She went through 4 different blood pressure medications before she found one that actually worked for her, and it was a generic one. But they started with the most expensive one, didn't work, tried another one, that didn't work, tried another one, that didn't work, and then they tried this generic one and it worked fantastic on her. So it's the same thing. Sometimes it's a trial and error.
Right. Okay. I see where you're going with it.
Yeah.
I appreciate I appreciate Stu McGill just because he's got a beautiful mustache.
Yeah, he does. He does. He's well known for that.
It's super impressive, that mustache. You know what I mean?
And you know what? Stu's probably one of the most humble people that you'll meet. He's just really, really smart. He likes science, but he doesn't take away from the empirical aspect of it. So he'll go, that doesn't make sense. So at the last Swiss Symposium, I had Kazmaier there, and Stu McGill was sitting in on a session, listening to how did Bill train? Like, how did he get so strong and all the different aspects of it? And what Bill said was not necessarily what Stu would say, but sometimes you can't, especially as an athlete, you have to do sometimes some stuff that isn't necessarily what you would call healthy or even very smart, but you would get the results that you want. And what Stu's focus now is that if you did injure yourself, or even if you're going to be lifting, here are some different protocols that you can utilize. And now through different types of imaging and all that, we're starting to see the structure of the body is a lot different. So the whole thing with the hip sockets, and it has different, conformations, and that can determine whether or not you can actually squat deep. So there are certain people that can, and certain people can't genetically. So how do you modify your style if you're a competitive powerlifter so that you can? And that's the empirical aspect of it.
Yeah, I think it's crazy. It's like the amount we actually know about the human body and the nervous system and the brain. It's like, mate, we've not even literally just not even waved our hand over the surface.
I just read another report. They found another quad muscle. So it's like we're finding different aspects of the body all the time. And through that, so I'll give you an example. When I was in school, they told us that the disc, the intervertebral disc, had no nerve innervation, because we couldn't figure out, if you have a disc herniation, why is it so painful? Because there's no nerves in there. Well, now, through different staining techniques, so when you, underneath a microscope, you use different types of stains to expose different things, we find that the intervertebral disc is the most highly innervated tissue in the body. It has a ton going into it and a ton coming out. So everything is always based on, are you able to test it and actually find it? And that's where I have a problem with evidence-based chiropractic medicine, physiotherapy. Everyone's like, you need these papers and the evidence. The evidence will always be based on, are you able to actually find it and test it? And a lot of times through different staining techniques, through different imaging techniques and everything else, we're finding out a whole bunch of different things that we thought were correct. Like I was taught that there's no nerves within the actual disc. Now, as an older practitioner, I'm finding there's a ton, in that. And that's how much things have actually. So if you stay with what you knew as far as the evidence and don't stay with the evidence and what's changing, that's where people get into, problems. So that's what we tend to see.
Yeah, and I think, we once thought the earth was flat. Do you know what I mean? And you'd be like, it is 100%. There's still people that believe that. I'm not taking anything away from it. You know what I mean? But the general sort of consensus is now it's round,
Well, and even if you take something as enormous as the universe, the universe is made up of, 70% dark energy. And no one knows what that is. And then you have 25% dark matter. And it's like, what is that? We're not quite sure. So we only know about 5% of what the actual universe is. So if we don't even know what the heck everything actually is, for us to start making constructs of, models and everything else, that's where we tend to get into trouble. So I'm a huge believer in finding out all the research. I got literally thousands of books and papers and everything else, and I attend seminars from all over the world. And also, I take a look at what works empirically, because that's the bottom line. Does it actually work? And I've seen wacky shit work. I really, really have. And I'm like, I have no idea what you just did, but it tended to work really, really well. And I'm not going to discount it because there's no model around it, or that we don't know how it works. That's a classic story of Englishman. He came over to North America, I think in the 1700s, and he noticed all the Indians were eating white willow bark whenever they had pain. So he was like, oh, okay. So he took it back to England, and he started to analyze it, and people would take it when they had pain, and the pain would go away. Well, what they found in white willow bark is that it's salicylic acid. The gentleman's name was John Bayer, the maker of aspirin. So that's what aspirin is made out of, salicylic acid, which is from white willow bark. So that's the story. They didn't know until 1971 actually how aspirin worked, and yet they were using it empirically. So again, don't throw out the empirical. Keep looking for science. Keep doing all the investigations and all that. And that's where I think that's the emergence of really good work, is see what works and also see what the evidence says on that.
Fantastic. A good combination of both there, brother, I think.
You have to.
Excellent. So Ken, what has been happening with you, my friend? What has been going on in your world?
Quite a bit. So I put on a large symposium every couple of years. It's called Swiss. And so I'm setting up right now for Swiss 2020. And that will be October 2, 3, 4. It'll be at the Hilton Hotel in Mississauga. And it's already turning out to be quite the event with everyone that is coming. We're going to have 5 or 6 streams at the same time. So a training stream, a nutrition stream, a rehab, treatment, rehabilitation, and another one I call the underground, which is sort of cutting edge, out there type of stuff, and to expose people to all the different things that are used within practice, and also things that you would not normally see. And so it's a combination of what my whole focus is to try and get the health professionals to work with the fitness professionals. That's always been my goal, and to create a referral system within that, so that, if as a chiropractor, I'm not going to spend a lot of time teaching people rehabilitation, or if they go into the gym, a personal trainer, a strength coach could spend an hour with them. I'm not going to spend an hour with them. And it's the same thing with the strength coach or the personal trainer. They don't have the skill set in order to fix a lot of things. And in fact, it's a little bit outside their scope if you're going to try and start diagnosing and treating people, on the gym floor, even though a number of people are starting to do that more and more. So finding out what are your strengths and weaknesses. I refer out all the time to medical doctors. If someone has a torn labrum in their shoulder, hey, get it assessed. Let's do an MRI. You may need surgery. You may need, PRP, plasma-rich protein, a number of different things. And then we can rehab it and everything else. But really respecting the boundaries on that. And that's what I really try and push within the symposium. So we'll have probably about 800 individuals there, attendees, about 70 presenters. And we're going to be talking about a number of different topics, everything from how to treat. We're getting some of the top powerlifters coming. So Dave Tate from Elite FTS, he's coming. Jael Holdsworth, Jim Wendler. We're going to have John Rusin from his protocols. He's coming. We're getting some top flight bodybuilders coming in. Nutrition, still working on some of the protocols for that. But as far as the theme this year will be, or in 2020 will be for the low back. Interestingly.
Perfect.
But the whole focus will be what is new, what is cutting edge, and how do you train properly? And if you do hurt yourself, how do you get it treated and how do you get it rehabbed? The other aspect is the networking aspect of it. So as a personal trainer, you're always looking for clients. Well, if you make an association with a good chiropractor or a good physical therapist, they can actually refer over to you, and you can build that protocol and build that association. And those types of networks, you actually have to meet the person, in person. Because a lot of times people are like, oh yeah, I should go see this person. I heard they're really good. And then you find out the person has basically some socially awkward behaviors. And it's like, yeah, you know what? Don't send me to this person ever again. They just bottom line creepy or weird or God knows what, because you've never met them. So the whole focus is, meet people, build associations, build network referrals, get an understanding of what's out there, and just have a lot of fun. The other thing that I'm doing is I teach an exercise muscle testing course. So I teach people on 50 different muscle tests, 25 for the lower body, all the different exercises, and 25 for the upper body. And what I did is, I'm not really too interested in which muscle is strong or weak. I am interested in, does the exercise range of motion work correctly? Is it strong enough? Do you have enough range? So range of motion to be able to do it, whether it be a bench press, a fly, a shoulder press. Some people can't even raise their arm up over their head, and their personal trainer said, oh yeah, you should be doing shoulder press. Well, you can't even raise it properly. So if that occurs, what can you do? And then you kind of differentiate and work within your scope to actually make those different types of changes. So those are the two main things that I'm working on. I got a number of other different projects that I'm working on also. Everything from the videos. So I do for the Swiss Symposium, everything is recorded, so it's up online. So Swiss Video Flicks or Swiss Videos, and you can get access to that too from 1999 when I first started it, 20 years ago. So I've been doing this for 20 years.
Flipping that, my mate. So it's like when it's like, oh yeah, I'm quite busy. I'm just looking through videos from 20 years, for the past 20 years.
Yeah, I know.
Flipping that, brother. So what we'll do is, Ken, like for the listeners, we'll have links to the Swiss website. We'll have links to the convention website. We'll have everything laid out in the description. So if you're interested, guys, check it out. It's right there for you. Everything's laid out. I've been to the Swiss Symposium. It was excellent. I had a great time. Yeah, it was
great having you guys there.
It was fantastic, mate. And if it's low back in 2020, we might make an appearance. You know what I mean? It'd be fantastic. It'd
be great to have you there.
Right. Okay, Ken. Now is the time. Now is the time, my friend. The questions that matter. Here it is, brother. Who would win a confrontation between a great white shark and a saltwater croc, and why?
I'm going to have to go with the great white shark. I think just size matters. This isn't a grappling situation. The great white shark would just take the saltwater croc out into the middle of the ocean and just, have at her. So I'm going to go with that. Now, do we actually know the answer?
Do I know the answer?
Yeah.
No, that's why I'm asking you.
Oh, okay. I was wondering if that's ever happened. Has a saltwater croc ever overtaken a great white shark?
Mate, I'm not too sure, but it may be worth looking at. You know what I mean?
You know what? We can Google that.
That's brilliant. Stay away from Google unless it's for questions that matter.
Yes.
Brilliant.
Meaningless advice.
Ken, it has been absolutely fantastic having you on, brother. And I'm going to finish it with,
awesome.
I'm going to finish it with a go Ken Kinakin! Did you know that DTS Fitness Education are actually an education company? That's right. So if you like what you see and you would like a little more, go to dtsfitnesseducation.com and check out our live and online courses.